Now we begin to look ahead. In your opinion, what does the future of health information systems in Zambia look like, and how does SCHISS in particular fit into that vision?
You see, the IHM's vision, let me start there, and how our vision align with evolution in terms of digital health solution. As IHM, we see a community where digital health and health informatics is within people's fingertips, and they're able to make decisions like that. The evolution or introduction of AI propels that vision and make it a reality, you know? Because now it's going to take us there even quicker. And so the vision for Zambia as a country, I think for me, I see Zambia as a trendsetter in this space, and I will tell you why I speak like that. I see Zambia having a resilient digital health system, you know. That's one where clients are uniquely identified and are being tracked and managed efficiently to realize positive clinical outcomes. That is a translation to public health positive outcome. That's where I see the country. However, I also see the country aligned in terms of international trend, you know. Just recently, I can say maybe in the past 2 years, the big organizations in public health, WHO, CDC, the World Bank, you know, you name them, they introduced what they are calling data modernization strategies, you know, to support global public health security. I think you know what I mean about that. We are coming from COVID. We have seen how security can be compromised if systems are not ready. And then to understand that systems are ready, you need data. You need data. You need AI-empowered solutions, you know, to catch those cases, like, you know, efficiently. And so this is where the country is going. This is where the country, for instance, in Zambia, I don't know before, when I started coming to Zambia since 2017, year after year, there is an outbreak in cholera, right? Year after year, there is an outbreak in cholera. But how do we use, you know, health informatics systems, you know, to efficiently detect cases and even respond to contain small clusters before a national blowout in terms of outbreak? This is where the country is going. Why? Because the country is going to tap into a routine system. They don't need to have a specialized surveillance project to detect cases. They will tap into the routine system, SmartCare Pro being at scale, to see the cases visually. I mean, this is one of the projects that we want to do as IHM, introduce syndromic surveillance, introduce biosurveillance to detect those biopathogens that can kill people. Talking of global public health security, even with the new administration in the US, I hope this is now not political. In the US, they are mindful about global security. Why? Because COVID hammered. It didn't spare anyone, right? And so they are aware that, I think they are clever enough to realize that we need digital solutions that are optimal, modernized, in countries to ingest data and monitor what is happening in the globe and respond before these issues come in country and attack us. So for me, this is where the country is going. That's the vision. IHM is in a good space, aligned. All the ducks are aligned. It's up to us to say, are we seeing the line of sight or what? One author says the Berkeley in the industry during the AI evolution is going to be won by early adopters for AI. You know, that also is in our mind, I mean, as an organization, but also as a country supporting Zambia.
That's a powerful vision of where IHM is going. I am particularly drawn to what you said about having information at one's fingertips. With that said, and now that data is becoming more central to healthcare globally, how do you see Zambia leveraging big data, AI, and machine learning in the coming years?
You see, I've already touched onto that by pitching it on global public health, you know. And I'll just give you one use case, and you will appreciate. So Zambia is at a stage where they are setting the stage in terms of not only AI, but also public digital infrastructure. This project we are leveraging this project to set public digital infrastructure in Zambia. As you know, our project is also involved in scaling up network, involved in scaling up power backup, involved in scaling up server and also cybersecurity framework. Those are the foundation of public digital infrastructure of goods, if you want. So we are also positioning ourselves for that as a country, so that we play at that level. But riding on that AI digital solution, AI empowered solutions, where then Zambia is going to be in a better position or is in a better position to implement those solutions and apply AI, like I indicated, to address issues of syndromic surveillance. Syndromic surveillance, it's not yet at the level that is expected. But now, as a country, we can tap into the infrastructure, we can tap into big data to predict cases. When we say syndromic surveillance, we just use syndromic features to say, Patrick, he's sweating, he's vomiting. Before we know that is typhoid, he's already being attended to, you know. Before cholera cases or clustering of cases are all over the country, we can manage them and respond quickly using AI.
Interesting. With what you have said, what are the biggest opportunities for Zambia's health system if we fully realize SCHISS's vision?
I've told you we are setting the stage. I've told you we are leaving a trail behind. That is positioning Zambia in a better space. If you have noted, our CEO is engaging at international level in terms of how do we position Zambia to be one of the African countries that can pioneer or even drive public digital infrastructure for Africa. You know, it is, I mean, we have realized, especially in the context, I hope again I'm not political, in the context of the new administration in the US, that we can no longer rely on the West. We need to provide our own solutions. We need to have our own digital infrastructure. We need to contextualize even our solutions and problems and apply data that is relevant to us to address our problems, not borrowed or adopted frameworks from the West that could not address the issues efficiently and impactful. So that's where we are taking the country to. And we are creating opportunities. You are saying, what are the opportunities? We are creating business opportunities where, like I indicated, the big institutions, the funders, the policy regulators at international level can see opportunities in the country and even invest more to expand these cases, use cases. But also, as an organization, we now have an opportunity to take these solutions beyond Zambia, to take these solutions across countries in Africa. We have that opportunity because these solutions are working and they are effective. So there is business opportunities, there is opportunities for public health and advancement, as I've indicated. There is opportunities for local solutions and contextualized solutions that are effective for Africans, right? This is what we are realizing with this project and are seeing as opportunities moving forward.
I see. I like that. I'm creating homegrown solutions.
Exactly.
Okay.
Exactly. In fact, that's how even IHM was born. It was the very same argument. For instance, having worked with Western international NGOs, sometimes, when we are addressing or implementing projects, you could see that we are struggling to strike a balance on a Western intervention and an African intervention that would work. Hence, we realized to say, we need to have indigenous organization like IHM to drive our mandate as Africans.
Sustainability seems to be a recurring theme I've noticed. With that said, what steps are being taken to ensure that the systems and skills built under SCHISS endure beyond the life of the project?
So I hinted on that as part of the outcomes for the project. And I added to say, as much as we have covered those things, let me, reiterate those things. We have documented a system such that if the ministry is able to take over, they will have reference in terms of technical documents, how this system was developed, what are the technical stacks, how is the system secured, what are the frameworks, the SOP, the guidelines, right? And we are transitioning those processes. We have addressed the issue of ensuring a sustained, health informatics workforce by developing health informatics curriculum that are going to be implemented and driven within localized universities to ensure that there is that sustainability in terms of the pool that can use such systems. We are also working with the ministry to start now setting up the organizational framework that is relevant for health informatics. Remember, we secured a digital health advisor within the ministry to drive that and make sure that that process is appreciated. As indicated, or maybe as an addition, our government and capacity building lead is already engaging with human resource department within the ministry on how to ensure that some of these roles are really onboarded into the schemes of service It's part of the structure for government, so that there is that sustainability. Just recently, we were talking with the Minister of Health, ICT Director, to say it is time where we ensure fully inclusion of the team and participation in operational areas of the project, again to ensure transfer of skills, but also ensure capacity building. There are a number of capacity building workshops that we've done. There are a number of capacity building initiatives that we are driving. Just thinking along the levels of the health system, we have built capacity among healthcare workers. Over 20,000 healthcare workers in the country are able to use the system. And that capacity has been built by IHM to ensure sustainability. We have done TOT within facilities among clinical champions to ensure that even when we are not there as a project, these people can shadow the healthcare workers in facilities and ensure that they're able to use and sustain the system. We have done also health informatics training at district, provincial, and national level, in data quality, in data science, in M&E, and also have trained district and provincial health teams to understand the system and lead implementation of the system.
Well, Pat, this has been a really insightful conversation. But before I let you go, I do have one question for you as project director. If you could paint a picture of Zambia's health information ecosystem 5 to 10 years from now, what would success look like in your opinion?
5 years to 10 from now. That is if we are all in the line of sight in terms of vision and strategy. That is conditional. I see a resilient, like I've said, I see a resilient digital health ecosystem in Zambia. I see meaningful AI-empowered digital solutions to drive clinical practice, to drive decision-making, to improve programming, to inform public health policy, but also to drive investment for the country. Those are the successes that I see between 5 to 10 years from now.
Thank you so much, Pat, for being on the show with us. It's been an absolute pleasure.
Thank you so much for having me.